Is this the normal setting? Like that? Like that? Three sisters. Oh, you did that. I'm just showing. Hello again. And this is you and Oh, he's here. Okay. It's 3:30. Okay. Good afternoon. It's 3:30, so I believe we are going to start. Welcome. It's so nice to see all of you. I hope you had a wonderful holiday season. Seems like it's still going on. It's still festive in here, so that's wonderful. We are missing quite a few directors today. So far, you have 2 of us, so at least you'll have 3 reports, I believe. But we'll get this rolling because I believe this is on Zoom. That's a good question. I don't have an answer to that. They're either on. Can you hear me now? Thank you for that. Always give me an indication if you can't hear me. I can't take the mask off. And we'll talk about that near the end. But welcome to the January edition of the State of the Business. And we will have our usual reports. And we will begin with Linda Price. Yes, we have somebody here.
Okay. Good afternoon, everyone. Can you hear me? If this thing will stay put? Okay, thank you. Happy New Year. Sorry you're stuck with me and Bill again. I think everybody's either on vacation or sick. So everybody's either on vacation or sick. So you're stuck with me again this month. So sorry about that. I need glasses these days. Okay, well, again, Happy New Year. I am happy to report that we had just a really, really good year in 2023. Not only as a community, but as Human Good, as the whole organization. I think it was mentioned that at Human Good overall had the best year that we have had since we affiliated back when we used to be ABHOW. For those of you who remember, ABHOW and B Group merged to become Human Good, and we have just really had a tremendous year. So for my department, as far as sales go, for independent living, assisted living, and memory support, we exceeded our budgeted occupancy in all 3 levels of care. Independent living, so I'm going to give you some numbers. So I hope this doesn't bore you guys. I mean, is this interesting to y'all when I report this kind of stuff, or is okay? Good. I mean, the goal, hopefully, if me and my team And of course, it takes all the other internal departments. We couldn't do it without them. We couldn't do it without you all being such good ambassadors with, being on resident council and the advisory board and the welcoming committee. So, it's not just me, Jana, and EJ taking credit for this. I give it to all of you collectively, and we appreciate you. And hopefully by keeping our community full in all these levels of care, it contributes to hopefully keeping costs lower for you and contributing to apartment renovations and the upkeep of our community and your beautiful homes. So in independent living, our budgeted goal for last year was to remain occupied at 170. We have 175 apartments in independent living, and we ended the year with 171 of those being occupied. The 4 that were remaining were reserved at the end of the year, and the move-ins just couldn't happen because we were waiting on renovations to be complete. So occupied and reserved, the corporation looks at that as being 100% occupied and reserved. But physically it was 98%. Our lodge, which is assisted living, completed the year at 98%. The budgeted goal for the lodge is to be occupied 43.5 apartments out of 45. I don't know why they put 0.5 in there. I don't know how we occupy half a person, but it is what it is. It just makes it a little harder because we have to actually bump it up to one more sale, or one more move in to actually exceed that. But we did. Out of 45 apartments, we had 45 occupied, and the one that is available is reserved for an internal move. The Grove is 100% occupied. They have 16 suites, so 16 of those are currently occupied. We also, I think most of our communities have a bigger challenge over the years or during the years at meeting their entrance fee, the budgeted goal for revenue, bringing those entrance fees into the community. Here at TLG, our net budgeted goal was approximately, and I'm rounding up or down, was approximately 6.5 million. Our Rockstar team, again, collectively with all the teams, were able to bring in move-ins and entrance fees in excess of 13 million. We have exceeded, I've been here 12 years, we have exceeded our revenue and moving goals every year since I've been here. But to have doubled it is really, I feel like, exceptional. And again, I appreciate everyone that contributes that. Thank you. Thank you. Yeah, it takes a village. It's not one person. So it really does. And this is like home away from home for most of us who have been here for a number of years. So it makes us very proud to be able to be successful, and hopefully it helps you all in some way as well and brings in you great new neighbors. So overall, we welcomed a total of 25 great new residents. It actually probably more because that's not including couples. That's just considered a move-in. So we had 25 move-ins or 25 apartments that turned this year that we had new people in. So that leads kind of into the December move-ins that we had. I try to welcome the new people every month when I report for the previous month. So on December the 4th, we welcomed, and if you're here, feel free to stand up. Hopefully you've had a chance to meet Tom and Jan Gleason. Again, I know it's hard when it's that first month. That usually takes them a while to get settled in, and we may not see them in this forum, for a month or two. But Tom and Jan Gleason came in on December the 4th, and they're in P394. And Jim and Machiko Masuda, their moving truck came in on 12/20. I know some residents have asked me about them. They're in E322. But the truck did come. They've pretty much physically moved their things in, but I don't think they've had their first night here. I think they've been having some meals in the dining room. But if you see either of those couples, please help us welcome them. And then we're expecting 3 move-ins for January. Out of those 4 I told you that were sold. One actually moves in tomorrow, so you'll see a moving truck out there. And that will be Carlo and Evelyn Padron, who are moving into N261. And then we'll have 2 more upcoming move-ins in January, one on the 15th, and the third one is estimating between the 26th and the 28th. And then I'll welcome those folks next month. The wait list continues to stay strong. Our wait list is well over a year, at least probably 2 years. we've got about 20 clients on each apartment style list. The wait list fee is now $10,000, but again, it's refundable for, I know you all have a lot of friends on our wait list, and that's refundable if they withdraw, or it's applied to their entrance fee if they move forward with a move in. And I think that's pretty much it to wrap up 2023. We're looking forward to a really strong 2024 as well, again, because the wait list is strong. And we are starting January out with 3 move-ins, which is real usual. In years past, it seemed like the corporation, because we are such a strong community here, I think sometimes they wanted us to help kind of carry some other communities. It may not have the strength that we do. And they would ask us to move sales forward, move people in earlier if we could, to have a strong closeout to a year. It's just business. And I know most of you were in business in your careers. This year, they didn't ask any of us to do that. And because they didn't, some of those due to renovations can't come in. So we're starting out with 3 move-ins in January, where normally we have 0 move-ins in January and February and pick up again in March. So to have 3 move-ins in January and start that first quarter out is really, really good. And then we've got a couple of events already planned for next year. I'll be doing 2 webinars. I'm hosting those with a local realtor. Those won't take up any of your space here. Again, they're online and it's with a realtor, and we open those up. We try to pick interesting topics. I'm doing one in February, one in May with him. They're free to the public. People can sign on. We send invitations out and pick different topics that hopefully help people plan, to sell a home or do estate planning, and what the process is for moving in or wait listing. So again, I'm doing one with him in February, one in March, and then in May, we have our annual downsizing event, which many of you probably came to during your time before you moved in. But anyway, thank you all for a great 2023. We appreciate you, and we're looking forward to another strong 2024.
Thank you, Linda. Can I say that number one more time? Was that $13 million in entrance fees? That deserves another round of applause. That's amazing. Great work. Thank you. Next up, Christy. Christy is out today, but she sent in a report and she would like me to read that to you. Let's see. So for onboarding in process right now, she has 2 housekeepers and 1 cook. And one very important position that you're all wondering about, she has the executive director in process right now. I'm sure some of you have met that gentleman. Round of applause. Yes. That gentleman will start the week of January 16th. Wonderful news. Wonderful news. And then new hires, we had a post-acute liaison, which just happened to show up. Could you come up, please? This is Nicole Wojnowski. So she does our admissions for the health center, and she's been doing a fabulous job since she started with December 18th. December 18th. So this is Nicole. Welcome her. She comes to us from Plumtree, which is a skilled nursing facility right next to Good Sam. So she has very extensive knowledge, lots of contacts in the business, and we are lucky and blessed to have her here. Would you like to say anything? Give them a little more insight of who you are and here.
Sure. So I'm Nicole. I've been doing this for about 10 years now. And yeah, so I feel very welcome to be here. I used to work at the Terraces of Los Altos when I first started in the industry. So it's been kind of full circle for me. So I feel right at home, and it's been awesome to be here. So thank you.
Thank you. So she will be your contact if you ever, God forbid, are at the hospital. They will contact Nicole to bring you back home. She is your contact. She's the person who connects with the hospitals, Good Sam, Stanford, El Camino, O'Connor, all the hospitals, to make sure that you get back here to your home. All right. Thank you, Nicole, and welcome. We have several January service anniversaries. So for 0 to 5 years, we have 6 team members celebrating that in January. For 6 to 10 years, another additional 6 team members. 11 to 15 years, we have 2 team members. 16 to 20 years, 2 team members. Amazing. So today, actually, in the health center, one of our CNAs, her name is Fung Win. She's celebrating 18 years with us in the health center. Amazing. And then in the lodge, we have a resident assistant, Maria Racinos. She is celebrating 18 years as well this month. So another round of applause for those folks who've spent lots of time here celebrating with you. Thank you, Christy, for that report. Next up, Paul. I did not see Paul come. He must be handling some emergency situation, but I'm sure he'll have a full report for us next month, or you can catch up with him in the dining room, and I'm sure he'll be more than obliged to give you a report. Next up, Adrian Marshall. Before Adrian comes up, I heard we had the most fabulous New Year's celebration this year. Do you all agree? Great. That's wonderful to hear. All right, Adrian, great work for you and your team. Come give us a report.
Thank you. Thank you. Can you all hear me? Okay, perfect. Thank you guys so much. So I just want to kind of like recap from our last 2 major events, the New Year's Eve party and the Mistletoe and Martini party. Those 2 parties were very well attended. We just want to say thank you for signing up, because you signed up, you were able to have the appropriate amount of food, the appropriate amount of drinks, and it was really well attended. And I just want to say thank you all for showing up. Also going forward, just a little housekeeping stuff. The lunch outing that always happens on a Friday, that is going to be switched because of schedule change. Elizabeth only works Sunday through Thursday now, so that's going to be on a Wednesday. So all the outing, the lunch outing, it's going to fall back on a Wednesday. I heard it was on a Wednesday before, so we're going back to Wednesdays. And just going forward with any activities that we're having and that we put up on the cubicle, we always ask for you guys to sign up, because we want to make sure that we are properly having the appropriate stuff so that everybody can take part within the activities. So we highly, highly, highly encourage you all to sign up. All right? Thank you so much.
Thank you, Adrian. I'm going to see what order the health center's in, because we have to expedite something. So let's see, are we next? No, that was for Sandy. Can we go next and then I'll bring you up? Okay. So for the health center, I want to, you've already met the new post-acute, that was Nicole, but now I would like to bring up our infection preventionist. This is Lady. You've probably met her before. Come on up, Lady. And we're going to talk a little bit about COVID-19. I understand there's been a little confusion regarding mask and isolation and those kind of things. So I brought Lady, who's the expert in this realm, to report on this and then take a few questions so that we can have clarity within the community. Okay, Lady, if you can elaborate on where masks are required, the isolation protocol, so on and so forth.
Hello, my name is Lady. I'm the infection prevention nurse. So I'll start with masking. So for the winter season, that starts October all the way through March 31st, everybody in the community, in the building, is required to wear a mask as long as you are in areas where healthcare is provided. Now, there is exceptions for residents. those that have respiratory issues, who cannot wear a mask and breathe properly. There are exceptions. But for staff, we have to wear a surgical mask. It cannot be the cloth mask, the homemade mask. It has to be a appropriate mask, which is the surgical mask. Do you have any questions in regards to the masking? No? Okay, good. So we'll move forward to COVID-19 testing and isolations. So for any residents that are in the independent living, you are considered part of the general public. So the general public, the isolation protocol is different from skilled nursing and anywhere in the healthcare setting. For independent living, you are only required to isolate for 5 days, but you do have to have a negative test result for you to come out of isolation on the 5th day. If you no longer have symptoms and you tested yourself and you are negative, then you are more than welcome to come out of isolation on the 6th day. So 5 days isolation total, and then the next day you can come out of isolation. But if you do have symptoms, it is highly, highly recommended that you stay in isolation and complete your 10 days. The same goes if you have a positive result, then you are still have to isolate for a total of 10 days. Okay. Now, if you do come out of isolation, if you are negative and you have no more symptoms, then you don't need to wear a mask outside unless you are inside the building. But if you do have still symptoms, coughing, a slight coughing can last for a long time, right? So even when you're done with your 10 days isolation, you can still have cough. We just do recommend that if you're getting together with, family members or anyone, that you still do wear your mask. Is that clear? Okay. Now for the healthcare setting, oh, yes.
If you are exposed to someone who has COVID, what are we supposed to do?
So for exposure, if you are exposed to someone who has COVID, we do have to ask you to isolate. Now, your isolation will be a total of 5 days. You will be tested on the day that you are exposed, depending on when you found out you were exposed and whether or not that person had symptoms. So technically, you want to test at least 24 hours after exposure, and then again on the 3rd day after exposure, and then again on the 5th day after exposure. Now, on the 5th day, if you are still negative, then you can come out of isolation. You are considered out of the danger zone, okay? Is that clear for everyone? Yes? Okay. Now, for healthcare, that includes the Memory, Grove, Lodge. Sorry, is that Lodge? Assisted living. So assisted living, Memory, and the skilled nursing, our protocols are all the same. Once you test positive for COVID, you have to isolate for 10 days. And then after 10 days, when you're done with your isolation, you no longer need to test. You don't have to test out of isolation. You automatically come out of isolation after 10 days, which means on the next day, the 11th day is when you come out of isolation. But you do have to isolate for a total of 10 days or longer, depending on how bad your symptoms are. But you no longer need to test. So when you test positive, if you continue to have a cough that's related to when you first tested positive, you don't need to keep testing, because unfortunately, sometimes you can still test positive, but it doesn't mean that you are contagious. It just means that it's still able to detect the virus in your body. But if you have a new symptoms that's not related to your previous COVID-19 infection, that's when you are advised to test. Clear? Is that clear? Yes, sir.
Could you go over the symptoms, please?
So for symptoms, it's hard because symptoms can be exactly like the flu. Now, for this variant, the new variant, most of the symptoms are GI related, or that would include diarrhea, abdominal discomfort, nausea, and vomiting. Those are the symptoms of the new variants right now. But anywhere from a cough, fever, even runny nose, sore throat, body ache, the loss of taste and smell, those are all symptoms of COVID-19. But again, mind you, they can also be symptoms of the flu. So it's important that if you are in the independent living, that you request to be tested for influenza as well from your primary care provider. And then I'm not sure how it works in the assisted living and in the Grove, but in the skilled nursing, we also do testing for influenza if that resident is negative for COVID. So if you are negative for COVID, but you feel like your symptoms are severe enough, then I do suggest that you ask to be tested for the influenza with your primary care provider.
In independent living, can you also not request tests from the wellness department?
You can. They can come and test you if
Okay.
you, I believe that's how they've been doing it. That if you have symptoms and you want to be tested, you can request and then they will come and test you. Yes. And then we had, but I will let you know, I will speak with Bill when we do have more at-home test kits that can be available for you to test yourself at home. Okay. Do I have any more questions in regards to COVID and isolation?
Does the terraces know who is current in their vaccinations? Staff and residents?
Yes, we have to keep track of it. So we have to keep track of everybody's vaccination, including staff. Even though the flu vaccine and the COVID-19 vaccine are no longer a requirement for staff, we do still have to keep track because we have to report it to the Santa Clara County Public Health Department. Yes.
I will guarantee you that if anyone in independent living went to their doctor's office and got tested, the terraces does not know about it unless we happen to go into wellness and tell them.
You're talking about if you were tested
Nope.
at your
If you-
primary?
No. If you got, I didn't mean tested. I mean, if you got vaccinated at your primary care doctor, the terraces will not know about it unless you have gone and told them. And
Oh,
I'm
you're
not at-
talking about
I'm not at all
independent.
independent living.
Okay,
I'm
okay.
not at all sure everyone does.
Okay,
So you do
okay.
not likely have a complete record.
Okay. All right. Well, I'm not sure how that one will work, but I do recommend that if you do get vaccine, that you make sure you let your nurses know or Charmaine, so that they could add it to your chart. Yes.
Going back to masking, independent living and the healthcare area. When
Mhm.
we come in, the signs say that we need to be masks to enter this building.
Correct.
And yet when you explained it, it sounded like unless we were in a healthcare area, we didn't have to.
No,
Most-
so not healthcare, where healthcare is provided. So that's in the hallways, that's anywhere where you will be coming in contact with any other residents here in the building.
So it is the whole building.
Correct. The only place that it's not required is the kitchen. Or when you're in the dining room, of course, because you have to eat. You're very welcome. Any more questions, concerns? Right there.
How many people here are currently have COVID?
So I don't have the exact number, but we do have quite a few. Right now, we are in an outbreak. We are considered the whole community as an outbreak. We have COVID cases both in all departments. We have it in our independent living. We have it in our skilled nursing. We have it in the Grove, and we have it in the assisted living. We are currently under Santa Clara County Health Department investigation for the COVID cases because we are in an outbreak.
If we're playing cards in the game room, should we be wearing masks?
Yes, well, I highly recommend it that you wear a mask for your own protection, especially now because we are in an outbreak. You want to protect yourself. You want to protect the other people that are around you, and you want to protect the families that you have that might come and visit you. I know it can become, a nuisance to wear it, but it is a big help in preventing any illnesses that you can get from the winter season, especially.
There was a time when they would publish on Cubago how many people in independent living had COVID and go down the line, and that hasn't been done. No information on that at all has been given to us. You're telling us it's available in every department.
Correct.
How many in each?
I don't have the exact numbers, but I do know that in the skilled, for us, we have 2 residents that are positive in the skilled nursing. Yes. I know in the Grove, we have 8 that are positive and 3 team members that are positive. In the assisted living and independent living, I'm not sure the exact number. I don't have my list with me, but I do keep track of our positive cases. That I'm not sure. I can talk to
We'll work on that.
yeah, we'll see how that's supposed to be working. Correct.
Is there a question here?
Oh.
It's in the weekly update.
Oh, okay.
So it will be out on Friday. It's Thursday. Just to remind folks.
Yes. Oh, you guys are putting me to work today.
If you could demonstrate to the audience here, I see at least 5 people wearing masks that do not cover their noses. Could you demonstrate the proper way to wear a mask?
Yes, so it should cover your nose. You see how my mask is? It should cover your nose and your mouth, okay? And then the way to fit it around you properly is to have it pinched on your nose area and towards your cheek. Now, again, as I said earlier, for residents, there are exceptions, especially if it's, a respiratory issue, if it makes it hard for you to breathe. I have gotten confirmation actually just today from our current investigator from Santa Clara County Public Health, Sarah. I wanted to ask her to make sure that residents are required to wear masks, but there are exceptions. Any more questions, concerns? Yes, ma'am.
Is there a way to ask for an exception, or do we just decide for ourselves that we're exceptional?
Well, I think everybody is exceptional here, but no. So normally, if you're not wearing a mask, anybody from the healthcare department, even, anybody around you, you can ask, why aren't you wearing a mask? Or just remind, your neighbors or anybody that are around you, remind them to please wear a mask. And then they can tell you, it's hard for me to breathe, or I have COPD, wearing a mask makes it hard for me to breathe. We are a community. It is important that we communicate with each other and tell each other, if one is not wearing a mask, let's remind them. I know that sometimes we walk in the building and realize, oh, I'm not wearing a mask. So it's up to all of us to remind each other to please wear a mask. Any more? Yes? Or stay at home.
Just to be clear, when you're talking about this, it's, if you're at a committee meeting or something, you would suggest wearing a mask.
I would.
Everyone.
Anywhere, if you are meeting indoors, especially, and you know you're going to be within less than 6 feet apart from each other. Because you know, COVID, the rule of thumb is you have to be 6 feet apart, or if you spend more than 15 minutes, you are considered exposed. So to be safe, I will highly, highly recommend, please wear a mask for your own protection and the protection of other people that are around you. We are responsible for each other.
Super, thank you.
You're very welcome.
One more question, if there are any. We've got to get Lady back upstairs to protect our people in the health center. All right. Thank you, Lady. That was very informative. Thank you very much.
Thank you, everybody. Thank you.
Thank you, Lady. Okay. Thank you. Anything else you want to know about the health center? We've talked about COVID. We've talked about new post-acute. Our census right now is 41, and we expected 2 admissions. We've kind of dropped off. It's a little slow at the hospitals right now, but we still hit our record year of over 500 Medicare patients. So we also had a banner year in the health center. We averaged 50.2 census for the year, and our budget is only 49. So we exceeded it. So thank you. All right, if you don't have any questions for me in the health center, I'm going to go back to Sandy. Welcome, Sandy.
Good afternoon, everyone. It's been a while since I've been up here, and I can't answer the question of the cases, positive cases of COVID for independent living. Currently 2 residents and 1 team member at this time. I have just a few things right now. The salon, as some of you know, is closed because both hairstylists are out sick. I'm hoping that Veronica will be able to come back by Monday, but I won't have confirmation until Sunday. And Anna will be back on January 10. They do both miss you all. And the other thing that I wanted to talk about is Omar Romero. Omar has decided to go back to school, well, to continue his school, and which changes his schedule. He will no longer be a full-time employee and no longer have the lead position as a concierge. He will now be working weekends. You'll see him Saturday morning and Sunday morning doing the 4-hour shift from 8 a.m. to 12 p.m. So he'll still be around, but not as often. In his absence as being the lead concierge, I have taken over several tasks that he continues to, well, that he used to do, I have to say. So a little bit more work for me, but that's all right, I can do it. The other thing I wanted to talk to you about is wheelchairs from the wellness department. They're missing 1 wheelchair apparently. And if you know where it is, please let us know so we can return it so we can get that back. The sooner the better, because we have a few residents who may need it as well. That's all that I have. You have anything that you'd like to ask me at this time?
Do we know whether the beauty parlor team has COVID?
Well, it's kind of like a privacy thing. I can tell you 1 has and 1 doesn't.
Okay.
How's that?
So those of us who were there recently
Yes, they have been contacted, the
Oh, they
ones
have
that
been.
were, yes.
Okay.
We do normally do that contact analysis to see who has been with them at least 15 minutes and 48 hours prior
Okay,
to them contacting it.
thank you.
You're welcome. And I have contacted all those who are on the schedule for this week to cancel all appointments. Anything else? Well, I hope you know where to find me now, because I have moved, but I'm right across from that copy machine in the admin building. So if you need me, give me a call or come on by. Thank you. Oh, one more. Yeah.
Will Anna be back on the 10th to work that day?
Yes, she will be back on the 10th.
Okay, because I have a standing appointment.
Yes.
Okay, thank you.
Yes. I know hair appointments are important. All right, thank you very much, everyone. Have a pleasant rest of the day.
Thank you, Sandy. I do want to announce that I do haircuts voluntarily. So if you're missing the hairdressers, I'm available. All right, but I only do one style. Okay. Let's see, are we missing anybody? I think that's it. Vincent, he's on vacation right now. Vacation. Do we have a question over here, Flo?
I was wondering if you could please tell us the name of the person.
I don't want to botch it. The question is, do we know the name of the executive director coming? Is that the question? I believe it's Peter Morris. Yes, Peter Morris. I was not able to meet him. I was on vacation, so I apologize. I was educated a few minutes ago that it's Peter Morris is the executive director coming. Yeah. I want to announce also as a reminder, this month, the entire health services team will be training on a new electronic medical record system. So we have the conference room locked for a number of days. So just a reminder just to be nice and kind. And I believe it starts on the 11th of this month, that room will not be available. I also want to remind everyone that this is one big happy family. So when we're talking about masking, be kind, because we're all here together and we have to live here together. Another question? The question regards the conference room. If they had meetings scheduled in there during that time period, were they advised? Yes, Elizabeth should have connected with those folks who had the conference room reserved at the same time that the training is going on. So Elizabeth has taken care of that. Good question. It's 11th through the 30th. So no dance parties in there. Which day was your meeting? Okay. Is there another question? Turn it off.
I just want to remind everyone that we have our annual association meeting next Tuesday here in the GRA at 2:00 in the afternoon. And this is the one time that we really bring everybody together. Any of you who are in independent living, you are members of the association. The Residents Council is the one who administers what goes on, and come and find out what we've done in the last year. Really hope you'll come and listen in and participate in that.
Thank you, Flo. Any other questions before we close out this meeting? Well, thank you for spending your time with us here and learning about all the different things that we announce, and especially on the COVID situation. Patience and kindness. Thank you for being here.